Okay, so we're going to start off this session. So this session essentially entails, we're going to talk about the bronchiolitis and the throat infections in the children's, mostly in the infant or toddler age group. By far, the bronchiolitis is the most common childhood infection which we see in children's. The reason it's important to know what bronchiolitis is or what's the most common respiratory infection in the children is because if you know the background about it, the theory behind it, you can do things to prevent this from happening again. So thank you very much for Noor for inviting me to do this short presentation on bronchiolitis. My name is Dr. Mashhood. I'm an emergency medicine consultant. Been working both in UK and UAE. So I have a background in dealing with pediatrics as well as adult emergencies. So the toddler age group ranges between 12 to 36 months. So the question really is, why is this an important age group? The reason this is an important age group is the main reason that this is a very critical period for a child's growth. And if we can do things to prevent them from getting infection, that will really boost their immunity and help them to develop nicely. It is the bronchiolitis. It is said that 1 out of 10 or 1 out of 3 children will have bronchiolitis of some form in their childhood. Most likely bronchiolitis is common to happen within the first 2 years of the birth. So what is bronchiolitis? Bronchiolitis essentially is the inflammation of the small airways of the child. The airway starts from the throat, involves the windpipe and goes into the lungs. In the lungs are the smaller airways, which in a newborn or a young infant up to 2 years are extremely small. And for them to get blocked by either mucus secretion is extremely common. So once the inflammation or swelling of those small airways happen and they get blocked, the child becomes distressed, and that's what we essentially broadly call a bronchiolitis infections. Bronchioles essentially are the small airways. So inflammation or infection of this is called the bronchiolitis. 9 out of 10 most likely is caused by a virus. There's a special type of virus, multiple type of viruses, but one special type called RSV, Respiratory syncytial virus, which accounts for approximately 80% of the bronchiolitis. Now, I'm not going to go into the minute details or cliches of bronchiolitis because I know I'm addressing a non-medical, mostly a non-medical audience. So RSV, the virus, is the most important cause of the bronchiolitis. Because it's caused by a virus, hence its antibiotics is not the treatment of choice, and I'm going to talk about more in further details why we shouldn't give antibiotics in young children with bronchiolitis. So just to summarize, bronchiolitis is the inflammation or the infections, swelling of the small airways of the children, most common in up to 2 years of childhood. Now there are certain risk factors for children to have bronchiolitis. The most important risk factor is if the child is born premature, i.e. they are less than 37 weeks at birth, or they are preterm, then the risk of them having bronchiolitis is much higher. And if the child is less than 3 months old and they do end up getting infection, a viral infection, most likely they're going to end up having bronchiolitis. And children who have congenital or inborn disorders of the lungs or the heart do tend to have more of bronchiolitis compared to the other kids. And tobacco or cigarette smoking, the passive smoking, if one of the parents or relatives are smoking within the same household, tends to affect children more, and then they tend to have bronchiolitis or swelling or inflammation of the airways. So let's talk about what's happening in the rest of the world. In UK, for example, it is said that 1 in 3 children will end up having bronchiolitis within the first year of life. And most common is between 3 to 6 months. By 2 years, most of the kids tend to grow out of bronchiolitis, but they're still at risk of having bronchiolitis afterwards. So that's the UK. When you look at the US figures, bronchiolitis is one of the most leading causes of respiratory infection in infants. Now, it's a well-known fact that bronchiolitis is a seasonal infection. It mostly happens in winters, and it's not uncommon for a child to have multiple episodes of bronchiolitis within the same winter season. What it essentially boils down to is, how are you looking after your kid? What is the immunity status of your child? And what are the surroundings and the environments which are putting your child at risk of bronchiolitis? So this is the key thing, this is the key take-home message which I probably would like you to take home. The prevention or the things you could do to prevent bronchiolitis from happening in the first place. And later on in the presentation, we're just going to allude to some of the important facts. The most important thing to keep in mind is the bronchiolitis or the inflammation of the airways of the child. In 80 to 90% of the cases do not require any specific medical treatment. I.e., you don't have to take them to the hospital, you don't have to give heavy dose antibiotics. Only 2 to 3% of the children who have bronchiolitis end up having some sort of treatment. So if you look at the child's airway, it's essentially made of very small tubes, and in winter season it gets inflamed. When it will get inflamed, they tend to swell up. The fluid which tries to accumulate within the small airways, when there's fluid and swelling, the airway gets smaller and smaller, so the oxygen delivery to the child gets compromised. So what are the signs and symptoms of a bronchiolitic child? As it is a viral infection, and mostly it happens in winters, so you will have, it's going to mimic those symptoms of flu-like symptoms, such as the child might have a stuffy nose, they might have nasal congestion, they will have cough, they might or might not have a temperature. The most important is the breathing will not be normal. So you will notice that they're breathing very fast, they're breathing very erratically, and that's when you have to suspect, does my child have bronchiolitis or not? As mentioned earlier, it's mostly 80 to 90% is caused by a virus, most likely called a respiratory syncytial virus, or RSV in the medical terms. There are other viruses which can cause, like adenovirus, but that's beyond the scope of this presentation today. So antibiotics have no role unless the child getting a bronchiolitic infection gets a predisposed bacterial infection. So if the child is really unlucky, they have a virus infection, and then a bacteria starts and causing pneumonia to it. Because it's a very mild infection, and 80% approximately do not require medical treatment, therefore do not require any specific test. This could be either dealt with a family or general physician. You don't have to end up going to the emergency department of a hospital just to get your child checked up for bronchiolitis, unless there are certain features which we're going to talk about in the next few slides. If those are present, then yes, you have to take the journey to the nearest emergency department. If you do end up going to your general practitioner or family physician, most likely what they're going to tend to do is they're going to examine the child's chest, they will check the oxygen saturations, a temperature, and they might take a swab or a test from the child, either from the nose or the throat, to check for the virus or the RSV virus. And most of these cases can be managed nicely at home, so they don't need to come to the hospital. Now, the duration of symptoms is important to note. If your child has a good immunity level and you take all the precautions, the child tends to have the bronchiolitic infections up to a week. Because it's a virus, it has to go away within a week or two. But it all comes down to how you are looking after your child. So the duration of symptoms is anywhere between 1 to 2 weeks, and in very small minority of the children, they do tend to have recurrent infections within the same winter season. It's a virus infection, so it's contagious. So if you have a couple of 2 or 3 children in the same household, most likely each of them will get infected because it's easily transmittable, it's contagious, it can be spread through droplets. If the child or adult who has a virus coughs or sneezes, it can transmit these infections to the other children or the other household members. And it's a contact infection, so it can be spread through contact. For example, if the infected child gets in touch with a toy, contaminates it, and the other child comes in, touches the same toy, so it will easily transmit the infections to them. So it's a droplet infection, sneeze, a cough, and as well as contact infection transmission. So you have to take care of the surfaces. Don't be alarmed if the child is breathing very noisily, if it becomes a very noisy breathing, because this is what tends to happen when the airways of the child becomes choked or gets swelled up or gets blocked with mucus. So they start making noises. Especially if the child has a stuffy or a congested nose, they will make additional noises. And if it's in the lungs, it will make noises like V's, which are added noises. For some parents, that could be a bit disturbing. So which children or child you have to take to the hospital? So what are the indications for taking to the hospital? Because we already mentioned before, the majority of the children can be managed at home, or they could be seen by a general practitioner. For a very small minority needs to go to the hospital. 10 to 20% needs to go to the emergency department. Out of those, only 2 or 3% of the total patients needs to be admitted. So following are the patients, children who need to take it. The child who is really tired, is dehydrated, or is not taking his feeds. Essentially, he's off the feeds. These are the type of children that they need to be taken to the hospital, because the most important thing that's going to fight off this infection is the hydration level of the child. So if the child has a very good hydration levels, if you encourage feeding, if the feeding is being up to date, then most likely the infection will recover very quickly. But if the child, because they might have a temperature, they might be lethargic, fatigued, not feeling well, if they're off their feeds, they have to be taken to the hospital, because at that point they need to be fed through a tube, through the nasogastric tube, through the nose into the stomach, or they need to have intravenous fluids to be given. The feeding is very important. The other children that need to go to the hospital are the ones in which the oxygen saturations drop. So if you notice that your children have a very low oxygen saturations, you can keep an oximeter at home. It's quite available. Portable oximeters could be easily purchasable from pharmacies. If you notice the oxygen saturation dropping, then yes, you need to take the child to the hospital. The other thing is, because if the child is not feeding, they are very high risk of getting dehydrated. And if the child gets dehydrated, the infection is going to get worse and worse. Those kids which are very fussy and they are not being comforted by any measures, we need to get a look at them very quickly within the emergency department, because again they are at risk of dehydration. And if the child is breathing very fast, if they're breathing more than 40 breaths or 50 breaths per minute, and you're not happy with the breathing, it's better to get them checked out in the emergency department. That comes to the question, how do we know a child is dehydrated? They're very simple clinical clues in children. The problem is you can't take a history, they can't communicate to you what's going on with them, so you have to go with the clues which you can find out. The most important one is the number of nappies that you change normally. On a good day, if a child has approximately 4 to 5 nappy changes and it drops to 1 or 2 and they're not fully soaked with urine, that's a very giveaway sign, very important indicator that your child is dehydrated or he's not taking enough feeds. So roughly a child you should be changing at least 4 to 5 nappies per day. In some children who feed a lot, number go slightly up. It might be slightly low, but if it goes down to 1 or 2 nappies a day in 24 hours, that's a telltale sign there's something wrong with the child. So number of nappies is a very important one. And along with the number of nappies, if the content of the nappies, i.e. they are fully soaked with urine or not, will give you an indication whether the child is dehydrated or not. Because if the child is not drinking enough, they will not produce urine. The other thing which physicians or doctors look at the hospital, or the nurses look at the hospital when such child end up to the hospital, is they look at the skin turgor, or whether the skin is looking very shiny or not. If the skin looks very dry, that again gives an indication the child is very dehydrated. So that's about a dehydration bit. Now the other important bit is the breathing bit. In broncholitic infections or the respiratory infections of the child, the breathing will be faster, it will be noisy. This might be upsetting or distressing for the parents, rightly so. But what's most important to note is if your child is breathing fast and the lungs or the chest wall is actually sucking in, so when the child breathes in, it will really suck in the chest wall inside. If that sucking happens on the external surface of the chest wall, that's a telltale sign that you have to take the child to the hospital. That means it needs some other intervention, some supportive treatment in the hospital. The other thing is you might notice the color of the lips, the tips of the fingers or the nails or the tongue, the color might turn blue. Again, if that happens, if the bluish coloration turns up on your lips, tongue or the fingernails, you have to take the child to the hospital. The third most important point is if the child has long pauses between breathing. So if child breathes and then takes a long pause, then takes a second breath, then again, if there's a long pauses coming in, you have to take them to the hospital. To summarize, 3 things you need to keep in mind for the breathing. First, if the chest starts sucking inside, disturbing sign. If the blue coloration comes up in the lips, tongues, or the nails, you need to take them to the hospital. Or if there are long pauses in between the breathing episodes, then that's important. So if you do turn up to the hospital, what should you expect? What you should expect, first thing to do is by the nurses or the doctors, they would put an oxygen meter or pulse oximetry to check the levels of the oxygen. Because invariably the oxygen level starts dropping in 10 to 20% of the total amount of broncholitic patients because the airways are compromised, the child is not getting enough oxygen through. So if that happens, they will put oxygen meter. If the oxygen levels are low, they will start giving some supplement oxygen either through the mask or through the nasal tubing so as to bring up the oxygen levels. They might or might not do a chest x-ray. The importance of doing a chest x-ray is that if there is a bacterial infection on top of a viral infection, that needs to be found out. Because if there is a bacterial infection, then that would be indication for giving antibiotics. Remember, broncholitic infections are mostly viral infections. They don't need antibiotics. But if they develop a bacterial infection on top of those, then antibiotics are indicated. So a chest x-ray will tell you this. So pulse oximeter, checking the oxygen levels, chest x-ray, and they will listen to the lungs. Now we're not going to talk about the whole medical management because that's a topic for some other day. The things which you could do. The aim is to keep your child comfortable and ease off their disturbing symptoms. As mentioned earlier, dehydration or lack of fluids is a big problem in children with broncholitic infections. So if your child is suffering from a viral infection, they have cough, sore throat, runny nose, they're breathing a bit fast, it's essential that you keep the hydration levels up. You keep the feeding up, which might include giving very small amounts of feed many times a day. But it's very important you do give regular feeding. Plenty of fluids is extremely important. The other things you could do is, especially winter season, you can put a humidifier in your child's room, which will help loosen the mucus or the plaques which are actually causing blockade in your small airways of your child. So humidifier could be a simple solution for loosening up the mucus in your child's airways. So hydration, humidifier. What you should do is in bronchiolitic infections, the child will get a nasal congestion and they might get a congested nose. So if a congested nose happens, so you need to relieve the nasal congestion. The things you could do is you can either use a nasal aspirator or a bulb to get rid of the nasal congestion, which will help with the breathing of the child as well. Invariably, these children do tend to develop temperatures. So if the temperature is high, they will not be feeling very well. Temperature makes the child very lethargic. So the key would be to keep the temperature down. The best way to keep the temperature down is to give the child regular paracetamols or ibuprofen. Now you have to look at the allergy status of each child. If they're not allergic to either paracetamol or ibuprofen, or there's no contraindication, then you can give them both but stagger them off. The way we normally tend to advise parents to stagger paracetamol is you can give the recommended dose of paracetamol up to that age group. You can give it at least 4 times a day, every 6 hours. So you give it regularly for a couple of days, keeping the temperature at bay. If there's no temperature, child will feel better, symptoms will be much better relieved, and they will eat and drink, hydrate themselves much better. So if you're still noticing that in spite of giving paracetamol regularly, the recommended dose 4 times a day, the temperature is still not coming down, you can chip in some ibuprofen. In between those 6 hours when the next paracetamol is due, you can give the ibuprofen from 3 hours from the last time you gave paracetamol. And the ibuprofen you can repeat at least 3 times a day. But this dosage, you should just get it checked by your physician or practitioner before you start doing this. But as a whole, paracetamol 4 times a day, recommended dose, is completely safe. And if the child is still not settling the temperature, you can add on an ibuprofen. Now, the other key things which a lot of research has gone through is how do we improve immunity in small child, because improving immunity in adults is simple. You take loads of vitamin C, multivitamins, eat fresh fruits and vegetables, and immunity level will get better. But in infants or less than 2 years of age, the best way to improve immunity is the breast milk. And a lot of studies, evidence is out there that the breast milk it has a lot of immunity, which helps the child to fight off these viral infections. Now the problem with breast milk is if the child has a congested nose or a blocked nose, they might struggle breathing while breastfeeding. So before you do that, just make sure the nasal congestion is gone away and you've used either a bulb or just to suction off the congestion, so that will help to bleed. Now, the prevention is extremely important. To prevent bronchiolitis, you have to take all the safety precautions. Now, we live in a COVID era. We are well aware what precautions we need to take. The first and foremost is you need to make sure your hands are clean, your children are clean most of the time. It is a very hard job to keep the children clean, especially if they're in the age group of roaming around. But you have to clean the surfaces of the household as well as the toys, because if the child is infected, they might transmit this viral infection to the other children by contact. So you have to do regular cleaning and disinfect your house, as well as regular washing of the hands with soap and water. If you suspect the most important thing is to do measures to avoid anybody of your household smoking within the house, because passive smoking has been shown to cause multiple respiratory infection in the children's, and as they grow older, it can also lead to conditions such as asthma later on. And the child of household in which there is active smoking within the house and they take passive smoking inside. They suffer from multiple respiratory infections many times a year. So you have to take measures or encourage your house members to smoke outside the house. Very important. If you think an adult has flu-like symptoms, it's best off to keep your child away from them in the nicest possible way, because what you don't want is to expose your newborn or a very young infant in front of somebody who's already infected with a viral infection. So that will bring to the close of bronchiolitis. Just to summarize, bronchiolitis is an extremely common infection in the childhood, mostly common in less than 2 years. Mostly 80% is done by a virus infection called RSV virus. Because it's mostly done by a viral infection, you don't need antibiotics for your child. Most of them can be managed quite safely at home with supportive treatment, making sure you keep up with the feeding, making sure you don't let your child get dehydrated, taking all the precautions such as avoidance of passive smoking, avoidance of child getting in contact with somebody who's got viral infection, cleaning the household judiciously, especially the toys of an infected child, so that the other child in the house do not get infected. If you do end up in the hospital, do remember that only up to 2 to 3% of the children do get admitted. So most of them is supportive treatment. You could get a pulse oximeter at home and check the oxygen levels of the child. Get a humidifier, especially at the night time, to loosen up the mucus in the airways. Use measures to decongest the nose. That would probably do the trick. Now for bronchiolitis, if you have any questions, do mention in the comments and I will answer them accordingly. In the meantime, I will move on to one other short discussion about tonsillitis, because that was also on our agenda. So tonsillitis. Tonsillitis essentially is the infection of the tonsils. So what are tonsils? Tonsils essentially are 2 lumps of tissues around the back of your throat, and they form part of your immune system. Immune system essentially protects anyone from infections. Tonsils play an important role in preventing infections in the childhood. Because they're really active in the young age, that's why they tend to get infected or swelled up quite a lot compared to adult age. And there is some school of thought that in adults when they become, the tonsils do not function as well as they do in children's. Tonsils are the first line of defense against infection and viruses which enter children's body. So they are an exceptionally important part of the line of defense. Because they are the first line of defense, that puts them in a very tricky position or vulnerable position to get infected again and again. So when the tonsils becomes red, they become swollen, then that's when we call they are tonsillar infections. Again, mostly the tonsillar infections are viral infections in the early childhood. Very uncommon, you're going to have a bacterial infection of the tonsils. Because it's a viral infections, we should not be just giving antibiotics blindly to the children. What is the problem with giving antibiotics again and again to a child? It will not help to develop the immunity. The antibiotics tend to destroy the normal cells as well. Thirdly, the bacteria, if there is, becomes resistant to the same antibiotics which is used again and again, and that's called bacterial resistance. So we need to hold off the antibiotics till it's essential, and there's certain criteria for giving antibiotics, especially in the child when they suffer from tonsillitis. Let's talk about the symptoms of tonsillitis. The first and foremost, they will complain of soreness in the back of the throat. They might have fever, and they might have swollen glands of the neck. Again, as with bronchiolitis, the first thing to do is to give supportive treatment, which will include keeping the temperature down, giving them regular paracetamol and also giving them regular ibuprofen. As discussed earlier, the paracetamol could be 4 times a day, spaced every 6 hours, and then you can give some ibuprofen every 8 hours, 3 times a day. So that will keep the temperature down. Remember, if the child has a temperature, he becomes really distressed. He won't be comforted till the temperature comes down. So how do you suspect if your child is having a tonsillitis infection? The first and foremost, they might drool. The saliva might drool from the mouth because the throat is so painful. If it gets infected with tonsils, the back of the throat becomes so painful that whenever the child eats and drinks, it hurts. Whenever the food, fluids or milk goes to the back of the throat and touches the inflamed tonsils, it hurts. So the child will refuse to eat and drink, and they will spit out or drool out whatever they're eating or drinking. So hence they will also start refusing to take feeds. If the child is starting to refuse feeds and they're drooling food, whichever is you've been giving, then you have to suspect they might have a tonsillitis infection. And the other thing is they might start vomiting because they can't keep things down. Because of the pain in the back of the throat, they will start vomiting. Now, tonsillitis, unlike bronchiolitis happens in a very young age, up to 2 years mostly, can happen up to 5 years. But tonsillitis normally tends to affect older child, but it can happen at any age. But evidence shows it most commonly between 5 to 15 years when the tonsillitis happens. But it's uncommon to have tonsillitis infection in less than 2 years, but it can happen, but uncommon. Most common in early teenage group between 5 to 15 years. Risk factors. The children who go to the school, i.e. the school-going age group children, are more prone to have tonsillitis. Just because they are in contact with a lot of children at school, which some of them might be carrying the viruses or bacteria, so they tend to get infected quite easily, as opposed to children who don't go to school or a young age that they are not going to school just yet. Tonsillitis is diagnosed on clinical examination, so you have to examine the back of the throat to have a look whether the tonsils are red and swollen, to think whether it's tonsillitis or not. Again, like bronchiolitis, when you swab for a viral infection, for the tonsillitis as well, the doctors at the general practitioner, GP clinic, family clinic, or the hospital's emergency department might test the back of the throat to see what has grown up, either a virus or a bacteria. If it's a viral infection, you don't need antibiotics. For bacterial infections, there are certain criteria when to give antibiotics. Same with bronchiolitis, you have to keep the hydration levels up. You have to give regular paracetamol and ibuprofen to keep the temperature down. In bigger kids, above 5 to 10 years, you can encourage them to do gargles with salt water, and they can use throat lozenges. Again, you have to make sure they avoid sweets or sugary drinks during their tonsillitis infection. Now, some of you might have noticed that there is a trend and the normal medical practice that some of the children do end up having tonsillectomy, or they do end up having tonsils removed. This is quite a debatable topic, but there are certain guidelines when tonsils should be removed. Some of the international guidelines suggest that if a child is having more than 7 infections per year, they should have their tonsils removed. Or if they're having more than 5 episodes in 2 years in a row, then you can then you can go for tonsillectomy. Or 3 episodes regularly every year for 3 years consecutively, that's the indications for tonsillectomy. But taking the tonsils out could be a big decision, because then if the tonsils are out, then you make your child prone to having more infections. Because remember, as discussed earlier, tonsils form the first line of defense in your child. So we're not going to talk about the bacteria which causes tonsillitis, because that's more from medical physicians based. Now, to give antibiotics, there are certain criteria. The child's temperature should be more than 38. There should be absence of cough. The neck glands should be swelled up, and there should be pus on the back of the throat. If these are present, then you need to give antibiotics. If these are not present, then antibiotics are not indicated. Okay, so just to summarize, like bronchiolitis, tonsillitis can happen. It's a viral infections, most commonly in between 5 to 15 years, but can happen in any age. Mostly common in school-going children's. Like bronchiolitis, if tonsillitis happens, antibiotics are not indicated because it's a viral infection, unless you're hitting those 4 criteria I mentioned. What you need to keep in mind is you need to keep the hydration, fluid status up to date, or making sure regular paracetamol and ibuprofen. Now, one of the questions which has just popped up is eating ice cream or any cold thing like frozen yogurt good for tonsillitis. Now, eating ice cream is recommended if you are having viral infection, but not in bacterial infection. Again, you should avoid sugary stuff if you're having a bacterial infection, because at the end of the day, the bacteria needs sugar. So, avoidance of sugary stuff is important, but what's more important to do is finding out and making sure it's a viral or a bacterial infection. That will be the most thing. At the start of any infection, a bronchiolitic infection or a throat infection, you need to keep the temperature down, give regular fluids and hydration, and that would be the key in treating these kids. And the first thing to do is making sure avoidance of environmental factors, like stopping smoking within the household, asking your house members to go outside to smoke if they can't stop smoking, making sure you don't allow your children to be in contact with anybody who's got cough, cold, especially in COVID scenario. That's even more important because these symptoms can mimic COVID as well. Fine. So these are the 2 slide presentations, small presentations on bronchiolitis as well as tonsillitis. If you do have any questions, please mention in the comments below when this post gets uploaded on Facebook, and we'll do our best to answer those questions. Now, the other question which has just come up is, it's better to have tonsils removed? If yes, what are the side effects of removing tonsils? Now, one school of thought is to remove tonsils if you're having multiple infections. Like if a child is having at least 3 infections per year for the next 3 years, then you can argue that because of those infections, the child's health is getting compromised, hence they're more prone to tonsillitis. It would be better off to remove the tonsils. Well, this theory can hold true for a very small amount of children, but one thing you need to keep in mind is the decision to remove tonsils is an important one, because once the tonsils gets removed, you are depriving the child of the first line of defense against the virus or bacteria. You need to remember the reason why the child is getting infected again and again, because they're prone to infections. So if you do remove tonsils, you are again putting your child at risk of those infections getting worse. But there's counter argument to either or. Personally, I wouldn't remove tonsils. I will try to fix the problem. Why is the child getting infected again and again? Is the dietary habit such that they are exposing my child to tonsillar infections, or the environmental factors are such that I live in a very cold environment? Then I need to start using humidifier, giving them gargles regularly. I would personally avoid tonsillectomy unless it's really important, essential, and it's compromising my child's health because of recurrent infections, and I cannot solve the environmental factors. So one more question is, at what age usually issue of tonsils trigger? So the incidence of tonsils can happen at any age, but it's uncommon to have it less than 2 years. Most likely, most of the child who do get infected with tonsils happen between 5 years to 15 years. And as we mentioned, this is the age group the children go to the school. So going to the school is itself a risk factor for having tonsillitis. But you have to self-educate the child what things they can and cannot eat, how they can protect themselves against making sure they protect themselves against the throat, regular use of gargles, especially if you live in a very cold environment or in the part of the world where temperatures go down significantly low. So you need to protect your tonsils. In the children above 10, you can give them hot drinks, but less than 10, not recommended to give hot drinks, but then gargles are important. Making sure you analyze your surroundings, the environment, what things you could or could not do to change the environment, like smoking. Making sure the child doesn't get in contact with any sick person who's already having a flu-like viral infections. Making sure you keep your house clean, your household clean. Making sure the virus and bacteria do not reside on the surfaces of the tables or surfaces where the child can be in contact with. I hope that's useful, the information we've given you today. So one more question which has just come up is, does living in desert areas cause severity in tonsil infections? So I mean, what I think they mean by desert areas is in areas like Gulf countries. Not necessarily. It's mostly more common, the tonsillar infections are more common in cold environments, more so than hot environments. But if you live in a very hot environment, the chances of the child getting dehydrated becomes higher. And again, in the hot environment, most likely people will be using the air conditioners much more commonly than they would do in any other environment. Then that using of the air conditioner again is an additional environmental risk factor that you need to take into consideration. What you don't want to do is put an air conditioner on at a very low temperatures, because that will again mimic the very winter or cold environment. So you need to keep in consideration that a very low temperature for air conditioner can put your child at risk for bronchiolitis or a throat infection, just like if they were living in a very winterish or very cold environment. So a moderate air conditioner would be more appropriate. Again, in a very hot environment, keeping the hydration up to levels, keeping a lot of fluid intake, juices, fresh fruits and vegetables, fresh juices to build their immunity, breast milk in the very infants is extremely important. And in a busy day-to-day lifestyle, we tend to miss out on these important factors. These simple things we can do which will help improve immunity in a child, in our children, and prevent them from getting these infections. Remember, these are very common infections. We tend to, in our emergency departments, in places where there is not very well developed family or physician practices or general practices, we tend to see the bulk of these infections, which ideally we should not be seeing in the emergency department. Because if you bring your child to emergency department, you are exposing them to other infections which they really don't need to, because emergency departments are full of infections. Those are the places where the sickest of the sick patients go to get help. I hope that answers all the questions for today. Thank you very much for the administrator for the All Round Mummies group for inviting us. I think these sessions are important to bring awareness to the general public, because that will help them give confidence to looking after the children or the new ones at home and preventing unnecessary emergency department visits where they're putting their child at risk of infections. And this is a very excellent platform for online consultation as well. In the period of COVID where we're living, we really want to minimize the contact of our child in the to the outside environment, especially till, fingers crossed, the vaccines gets developed. So if you have any questions, please post it on this the group, All Round Mummies, and we will answer those questions accordingly. And if you have any topics which you want us to cover for future as well, please let us know in the comments or message the moderator or the administrator, and we will surely do those topics for you, and we can do this online information and consultation for your child on this platform if needed, if required. So thank you very much for participating. I hope you enjoy the rest of the day. Thank you very much.